Two patients can have teeth that look almost identical, but one might need orthodontic treatment for 8 months, while the other might need it for 2 years. And the difference usually has nothing to do with how crooked the teeth look. It comes down to something orthodontists evaluate that most people, even many dentists, don't fully analyze before giving a treatment timeline. Let me tell you about a situation that I see fairly frequently. A patient will come into my office after visiting their regular dentist who suggested to them to do Invisalign. One patient told me that the appointment that they had was pretty quick. They took an iTero scan of her teeth, which showed the 3D model on a screen with little colored marks that showed how the teeth hit together. The dentist looked at the scan and said something like this: "We can straighten these teeth with Invisalign. It will take about probably 6 months." So this patient left the office thinking it was probably pretty simple, but what she decided that she wanted an orthodontist to have a second look and get a second opinion. When she came to my office and we did a full orthodontic evaluation, meaning me looking carefully at her bite, the position of each tooth, how the upper and lower teeth actually fit together, the situation was very different. Correcting the teeth and getting the bite to function properly was going to take closer to about 18 months. Believe it or not, I see the opposite situation as well. Other patients will come in being told that their treatment will take over 2 years, but when I evaluate the case, what I see is something that will take probably closer to about 12 to 18 months under my care. What these situations show is that orthodontic treatment time is very difficult to estimate without a detailed orthodontic diagnosis. When I look at a case, I'm not just looking at whether the teeth are crooked. I'm evaluating how the teeth fit together, how much space exists in the jaws, what types of movements are required to correct the bite properly. It's those details what determine actually how long treatment will take. I'm Dr. Eric Strouse, an orthodontic specialist, and today I'm going to answer a question that I hear all the time. How long does orthodontic treatment actually take? The answer depends on several important factors, and understanding those factors can help you know what to realistically expect if you're considering braces or Invisalign. The first thing that determines how long orthodontic treatment takes is the complexity of the orthodontic problem. Let's start with some examples of simpler orthodontic cases. Some patients are going to have what we call mild crowding or mild spacing. Crowding happens when there isn't quite enough room in the jaw for all the teeth to line up properly. The teeth may overlap, they may twist or rotate because they're competing for space. Spacing is the opposite situation. There's extra room between the teeth, which creates gaps. In many of these cases, the main goal of treatment is to simply align the teeth within the dental arch. An important thing to remember is that for these cases to be simple, it means that the bite, how the upper teeth and the lower teeth come together, are already in a good position. When the bite is stable and functioning well, we mainly need to straighten the teeth or close spaces, and treatment ends up being much more efficient. In situations like that, treatment may take somewhere around 6 to 12 months. But orthodontic treatment becomes more complex when the bite itself is what needs to be corrected. For example, some patients have what orthodontists call a class 2 or a class 3 bite. A class 2 bite means that the upper teeth sit too far forward relative to the lower teeth. A class 3 bite is the opposite situation, where the lower teeth or the lower jaw sit farther forward. Correcting these bite relationships often involve not just tooth movement, but also growth in younger patients and patient cooperation with elastics or different appliances. Another situation that we often see is what's called an overbite. An overbite refers to how much the upper teeth overlap the lower front teeth when biting down. Now, a small overbite is normal, but when the overlap becomes severe, what orthodontists call a deep bite, it can take longer to correct because teeth need to move vertically within the bone, not just side to side. There are also cases where multiple of these factors come together. For example, a patient may have severe crowding or severe spacing with a class 2 or a class 3 bite, which means we're correcting both alignment and the bite relationship at the same time. Sometimes patients have what we call a tooth size discrepancy, meaning that the upper teeth and the lower teeth are slightly different sizes and require careful planning so that they fit together properly at the end of treatment. This requires more tinkering and more management and can increase treatment time. Another situation that can increase treatment time is impacted teeth. An impacted tooth is a tooth that's trapped underneath the gums or the bone and cannot erupt normally. Bringing that tooth into its correct position can require additional time and careful guidance. So the complexity of the orthodontic problem is going to play a major role in determining the amount of time that treatment will take. A second factor that influences treatment time is the type of orthodontic appliances and the mechanics being used to move the teeth. How are they moving? Orthodontists today commonly use braces or clear aligners like Invisalign. Both can work very well, but they move teeth in very different ways. Braces can be very efficient when teeth need to rotate significantly, move vertically, or be guided into precise positions. Clear aligners can also work extremely well, but they require heavily on patient wear time, typically around 20 to 22 hours per day. If the aligners are not worn consistently, treatment time slows because the teeth are not receiving the forces necessary to move. Another factor is how the orthodontic plans and delivers treatment. Modern orthodontics allows for highly customized systems and digital planning, which can make treatment more efficient and predictable. A third factor that affects treatment time is how smoothly treatment progresses once it begins. For example, something like broken brackets can slow down treatment significantly. When a bracket breaks off a tooth, that tooth is no longer receiving the force needed to move it into its correct position. If brackets break repeatedly, treatment can take longer. Another factor is oral health and gum health. Teeth actually move more efficiently when the gums and the bone around them are healthy. If plaque builds up and the gums become inflamed, orthodontists sometimes need to slow down or even pause treatment until the gums become healthy again. Clear aligners and rubber bands also depend heavily on patient cooperation. When patients follow instructions carefully, treatment tends to move along much smoother. So to put it all together, when people ask how long does orthodontic treatment take, the answer depends on several things. What is the complexity of the orthodontic problem? What are the appliances and the mechanics being used by your orthodontist? And how smoothly will treatment progress during the treatment? Now let me talk a little bit about what this looks like in my practice. In my office, most phase 1 orthodontic treatments, which are typically early treatments for younger patients to achieve specific treatment goals, these take about 12 months. Comprehensive orthodontic treatment, which involves correcting the bite and aligning all the teeth when all the adult teeth are in, typically averages about 18 months. One of the things I focus on my practice is efficiency. That means careful diagnosis, strong patient education, so patients understand how to help treatment progress smoothly, as well as the use of custom orthodontic systems and modern planning techniques that allow treatment to be delivered efficiently while producing excellent results. The goal is not just to move teeth quickly. The goal is to move teeth the correct way, in a safe way, while efficiently creating a healthy bite and a stable result that lasts long after treatment is finished. If you're considering orthodontic treatment and wondering what the timeline might look like for your specific situation, the most important step is to have a proper orthodontic evaluation. And ideally, that evaluation should be done by an orthodontic specialist, not a general dentist. Orthodontists complete several additional years of specialized training after dental school, focusing specifically on diagnosing bite problems, planning tooth movement, and managing orthodontic treatment at a high level. Once a full orthodontic evaluation is done, it becomes much easier to understand what treatment will evolve and how long it will likely take.